Dear friends of wise old age, sexuality, and health, today we delve into a topic that is often uncomfortable to discuss, but is fundamental to our well-being as we age: erectile dysfunction. This condition can be a source of shame for many, but our goal is to equip you with the tools and information needed to understand and face this challenge with peace of mind. This discussion is specifically intended for those who have surpassed 60 years of age and may have noticed changes in their intimate lives. We aim to provide ways to continue enjoying this essential part of life. Erectile dysfunction is a condition that affects many men in their maturity. It is estimated that about half of men over 60 experience some degree of difficulty in maintaining a firm and lasting erection. This is not a condemnation or something to be ashamed of. In most cases, it is simply a natural part of the aging process, influenced by physical and psychological factors. Understanding these factors is crucial for managing the condition effectively. We will explore the role of blood circulation, the impact of conditions like hypertension and diabetes, and the influence of hormones such as testosterone. Additionally, we will address the psychological components, including stress, anxiety, and societal expectations, which can exacerbate the issue. Fortunately, there are many solutions, both medical and therapeutic, that have been proven effective. Lifestyle changes such as regular exercise and a balanced diet can significantly improve erectile function. Medical treatments, including medications and hormone therapy, offer additional options for those who need them. Communication within the couple is also vital, as open dialogue can alleviate pressure and enhance emotional connection. For those seeking a more natural approach, devices like vacuum pumps can help improve the body's response without medication. It's important to remember that erectile dysfunction is not something to face alone. Support from professionals and peer groups can provide valuable assistance. Finally, erectile dysfunction in old age is not the end of a fulfilling sexual life. With the right information, open communication, and professional support, it is possible to continue enjoying rich, satisfying, and meaningful intimacy. Mature sexuality can be just as rewarding as in youth if approached with the right attitude. If you find this information helpful and want to explore more about maintaining a healthy and fulfilling life as you age, we invite you to subscribe to our YouTube channel, Stoic Mind Mastery. Join our community for more insights and guidance on navigating these important topics with respect and knowledge. Let's get started. Part 1. Causes of erectile dysfunction. Erectile dysfunction, ED, is a multifaceted condition that can arise from a variety of physical and psychological factors. Understanding these causes is crucial for effectively addressing and managing the condition, especially for men over the age of 60. In this section, we will explore the primary physical and psychological contributors to ED, providing a comprehensive overview of how these factors interplay to affect sexual health. A. Physical causes. 1. Cardiovascular health. One of the most significant physical contributors to erectile dysfunction is cardiovascular health. The process of achieving and maintaining an erection is heavily dependent on adequate blood flow to the penis. As men age, the risk of cardiovascular diseases such as hypertension, high blood pressure, atherosclerosis, hardening of the arteries, and high cholesterol increases. These conditions can lead to the narrowing and hardening of blood vessels, reducing blood flow and making it difficult to achieve an erection. Studies have shown that men with hypertension are up to 70% more likely to experience ED compared to those with normal blood pressure. Similarly, atherosclerosis can impede blood flow, directly impacting erectile function. 2. Diabetes. Diabetes is another prevalent condition that significantly affects erectile function. Men with diabetes are twice as likely to experience ED compared to those without the condition. Diabetes can cause damage to blood vessels and nerves, both of which are critical for normal erectile function. The high blood sugar levels associated with diabetes can lead to neuropathy, nerve damage, and reduced blood flow, making it challenging to achieve and maintain an erection. 3. Hormonal changes. Hormonal imbalances, particularly involving testosterone, play a crucial role in erectile dysfunction. Testosterone is a key hormone in male sexual health, influencing libido, sexual desire, and erectile function. As men age, testosterone levels naturally decline, which can lead to decreased sexual desire and difficulties in achieving erections. While not all men experience a significant drop in testosterone, those who do may notice these changes more acutely. Low testosterone levels can also affect energy levels, mood, and overall vitality, further complicating sexual health. 4. Other medical conditions. Other medical conditions such as obesity, metabolic syndrome, and chronic kidney disease can also contribute to ED. Obesity and metabolic syndrome, which includes a cluster of conditions like increased blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels, can lead to vascular problems that affect blood flow. Chronic kidney disease can also impact hormone levels and blood circulation, further exacerbating erectile difficulties. B. Psychological causes. 1. Stress and anxiety. Psychological factors are equally important in the development of erectile dysfunction. Stress and anxiety, whether related to work, relationships, or other personal issues, can significantly impact sexual performance. Performance anxiety in particular is a common issue where the fear of not being able to perform sexually becomes a self-fulfilling prophecy. This anxiety can create a cycle of ongoing stress and erectile difficulties, as the pressure to perform increases with each encounter. 2. Depression. Depression is another psychological factor that can lead to ED. It affects mood, energy levels, and overall interest in activities, including sex. The chemical changes in the brain associated with depression can also affect sexual desire and function. Additionally, some medications used to treat depression can have side effects that include erectile dysfunction, further complicating the issue. 3. Relationship issues. The quality of a man's relationship with his partner can also influence erectile function. Communication problems, unresolved conflicts, and lack of intimacy can all contribute to ED. When emotional connections are strained, it can manifest physically, leading to difficulties in achieving or maintaining an erection. Open communication and addressing relationship issues can be crucial steps in managing ED. 4. Social and cultural expectations. Social and cultural expectations about masculinity and sexual performance can place additional pressure on men, contributing to psychological stress. The belief that intimacy must always involve an erection can create unrealistic expectations and unnecessary pressure, affecting both the man and his partner. Understanding that intimacy encompasses more than just physical performance can help alleviate some of this pressure. Conclusion. Erectile dysfunction is a complex condition with a variety of causes, both physical and psychological. By understanding these underlying factors, men and their partners can better address and manage the condition. Whether through lifestyle changes, medical interventions, or psychological support, there are numerous ways to improve erectile function and enhance overall well-being. Recognizing the multifaceted nature of ED is the first step toward finding effective solutions and maintaining a fulfilling intimate life. Part 2. Impact of erectile dysfunction. Erectile dysfunction, ED, is a condition that extends beyond the physical inability to maintain an erection. It has profound implications for a man's psychological well-being, relationships, and overall quality of life. Understanding these impacts is crucial for addressing the condition holistically and effectively. In this section, we will explore the various ways in which ED affects individuals and their partners, emphasizing the importance of a comprehensive approach to treatment and support. A. Psychological impact. 1. Self-esteem and confidence. One of the most immediate psychological effects of erectile dysfunction is its impact on a man's self-esteem and confidence. The ability to perform sexually is often closely tied to perceptions of masculinity and self-worth. When it occurs, it can lead to feelings of inadequacy and embarrassment, which may cause a man to withdraw from intimate situations. This withdrawal can create a cycle of avoidance and anxiety, further exacerbating the problem. Over time, the persistent nature of ED can erode a man's confidence, affecting not only his sexual life, but also his interactions in social and professional settings. 2. Anxiety and depression. The psychological burden of ED can also manifest as anxiety and depression. The stress of anticipating sexual failure can lead to performance anxiety, where the fear of not being able to perform becomes a self-fulfilling prophecy. This anxiety can spill over into other areas of life, causing general stress and tension. Additionally, the emotional toll of ED can contribute to depression, characterized by feelings of sadness, hopelessness, and a lack of interest in activities once enjoyed. Depression can further diminish sexual desire and exacerbate erectile difficulties, creating a challenging cycle to break. B. Impact on relationships. 1. Communication and intimacy. Erectile dysfunction can significantly affect relationships, particularly if communication between partners is lacking. The pressure to perform can create tension and misunderstandings, leading to a breakdown in communication. Partners may feel rejected or inadequate, interpreting ED as a lack of attraction or interest. This can lead to emotional distance and a decrease in intimacy, both physical and emotional. Open and honest communication is essential to navigate these challenges. Discussing feelings, concerns, and expectations can help partners understand each other better and work together to find solutions. 2. Emotional connection. While ED can strain relationships, it also presents an opportunity to strengthen emotional connections. Intimacy is not solely defined by sexual performance. It encompasses emotional closeness, mutual understanding, and shared experiences. Couples who focus on these aspects can find new ways to connect and maintain a fulfilling relationship. Emphasizing non-sexual forms of intimacy, such as cuddling, kissing, and spending quality time together, can enhance emotional bonds and reduce the pressure associated with sexual performance. See social and cultural impact. 1. Societal expectations. Societal expectations and cultural norms around masculinity and sexual performance can exacerbate the impact of ED. The belief that a man's worth is tied to his sexual prowess can create additional pressure and stigma. This can discourage men from seeking help or discussing their condition openly, leading to feelings of isolation and shame. Challenging these societal norms and promoting a more inclusive understanding of masculinity can help reduce the stigma associated with ED and encourage men to seek the support they need. 2. Quality of life. Ultimately, erectile dysfunction can affect a man's overall quality of life. The condition can lead to a decrease in life satisfaction, affecting not only personal relationships but also professional and social interactions. Men may experience a loss of motivation and a decline in overall well-being. Addressing ED holistically, by considering both physical and psychological factors, is essential for improving quality of life. This includes seeking medical treatment, engaging in therapy, and making lifestyle changes that promote overall health and well-being. Conclusion. Erectile dysfunction is a complex condition with far-reaching impacts on a man's psychological health, relationships, and quality of life. By understanding these impacts, men and their partners can take proactive steps to address the condition and improve their overall well-being. Open communication, emotional support, and a willingness to seek help are crucial components of managing ED effectively. With the right approach, it is possible to overcome the challenges of ED and maintain a fulfilling and satisfying intimate life. Part 3. Diagnostic methods for erectile dysfunction. Diagnosing erectile dysfunction, ED, involves a comprehensive evaluation to identify the underlying causes and determine the most appropriate treatment options. Given the multifaceted nature of ED, the diagnostic process typically includes a combination of medical history assessment, physical examination, laboratory tests, and psychological evaluation. This section outlines the key steps and considerations in diagnosing ED, emphasizing the importance of a thorough and personalized approach. A. Medical history assessment. 1. Patient interview. The diagnostic process begins with a detailed patient interview to gather information about the individual's medical history, lifestyle, and sexual health. During this interview, the healthcare provider will ask questions about the onset and duration of ED symptoms, the frequency and quality of erections, and any changes in sexual desire. Understanding the context in which ED occurs, such as specific situations or times of day, can provide valuable insights into potential causes. 2. Review of medical conditions and medications. A comprehensive review of the patient's medical history is essential to identify any underlying health conditions that may contribute to ED. Conditions such as diabetes, hypertension, cardiovascular disease, and hormonal imbalances are known risk factors. Additionally, certain medications, including antihypertensives, antidepressants, and antipsychotics, can have side effects that impact erectile function. The healthcare provider will assess the patient's current medications and consider potential interactions or side effects that may be contributing to ED. B. Physical examination. 1. General health assessment. A physical examination is conducted to evaluate the patient's overall health and identify any physical signs that may indicate underlying conditions. The healthcare provider will assess vital signs, such as blood pressure and heart rate, and examine the cardiovascular and nervous systems. This assessment helps identify potential risk factors, such as obesity or metabolic syndrome, that may contribute to ED. 2. Genital examination. A focused examination of the genital area is performed to check for any anatomical abnormalities or signs of hormonal imbalances. The healthcare provider will assess the penis and testicles for any physical changes, such as Peyronie's disease, curvature of the penis, or testicular atrophy, which may affect erectile function. This examination also helps rule out any structural issues that could be contributing to ED. C. Laboratory tests. 1. Blood tests. Laboratory tests are often conducted to assess hormone levels and identify any underlying medical conditions. Blood tests may include measurements of testosterone, luteinizing hormone, LH, and prolactin to evaluate hormonal balance. Additionally, tests for blood glucose, cholesterol, and lipid profiles can help identify metabolic or cardiovascular issues that may be contributing to ED. 2. Other diagnostic tests. In some cases, additional diagnostic tests may be necessary to further evaluate the underlying causes of ED. These tests may include nocturnal penile-tumescence, NEP test. This test measures erections that occur during sleep to determine if ED has a psychological or physical cause. Healthy men typically experience several erections during sleep, and the absence of these erections may indicate a physical cause. Doppler ultrasound. This imaging test assesses blood flow to the penis and can help identify vascular issues that may be contributing to ED. It involves using sound waves to create images of blood vessels and measure blood flow during an erection. Intracavernosal injection test. This test involves injecting a medication into the penis to induce an erection, allowing the healthcare provider to assess the quality of the erection and identify any vascular issues. D. Psychological evaluation. 1. Assessment of psychological factors. Psychological factors, such as stress, anxiety, and depression, can significantly impact erectile function. A psychological evaluation may be conducted to assess these factors and determine their role in ED. The healthcare provider may use questionnaires or interviews to evaluate the patient's mental health and identify any psychological barriers to sexual function. 2. Relationship and lifestyle factors. The evaluation may also consider relationship dynamics and lifestyle factors that could be contributing to ED. Issues such as communication problems, emotional stress, and lifestyle habits, e.g., smoking, alcohol use, can all play a role. Addressing these factors through counseling or therapy can be an important part of the diagnostic process and subsequent treatment plan. Conclusion. Diagnosing erectile dysfunction requires a comprehensive and individualized approach that considers both physical and psychological factors. By conducting a thorough assessment, healthcare providers can identify the underlying causes of ED and develop a tailored treatment plan that addresses the specific needs of the patient. This holistic approach is essential for effectively managing ED and improving overall sexual health and quality of life. Part 4. Treatment methods for erectile dysfunction. Erectile dysfunction, ED, is a condition that can be effectively managed with a variety of treatment options tailored to the individual's needs and underlying causes. The goal of treatment is to restore sexual function, improve quality of life, and address any contributing health issues. This section explores the primary treatment methods available, including lifestyle changes, medical interventions, and psychological support. A. Lifestyle modifications. 1. Exercise and diet. Regular physical activity and a balanced diet are foundational components of managing erectile dysfunction. Exercise, such as walking, swimming, or yoga, enhances cardiovascular health, improves blood circulation, and reduces stress levels, all of which can positively impact erectile function. A diet rich in fruits, vegetables, whole grains, and healthy fats like olive oil helps maintain healthy blood vessels and supports overall heart health. Reducing the intake of processed foods, sugars, and unhealthy fats can also contribute to better erectile function. 2. Smoking and alcohol reduction. Smoking cessation and moderating alcohol consumption are crucial steps in improving erectile health. Tobacco use damages blood vessels, reducing blood flow to the penis, while excessive alcohol can impair the nervous system and decrease sexual responsiveness. Quitting smoking and limiting alcohol intake can significantly enhance erectile function and overall health. B. Medical treatments. 1. Medications. Oral medications such as phosphodiesterase type 5 inhibitors are commonly prescribed to treat ED. These medications, including sildenafil, Viagra, tadalafil, Cialis, and Vardenafil, Levitra, work by increasing blood flow to the penis, facilitating an erection in response to sexual stimulation. It is important to note that these medications require prescription and should be used under medical supervision, as they can have side effects and may not be suitable for men with certain health conditions, such as severe heart disease. 2. Hormone therapy. For men with low testosterone levels, hormone replacement therapy may be considered. This treatment involves supplementing testosterone to restore normal levels, which can improve libido and erectile function. However, hormone therapy should be closely monitored by a healthcare provider due to potential risks, including cardiovascular issues and prostate health concerns. 3. Vacuum erection devices. Vacuum erection devices, VEDs, are a non-invasive treatment option that can help achieve an erection by creating a vacuum around the penis, drawing blood into the area. These devices are particularly useful for men who cannot take oral medications or prefer a drug-free approach. While VEDs may not be the most glamorous solution, they are effective for many couples and can be used in conjunction with other treatments. C. Psychological support. 1. Counseling and therapy. Psychological factors, such as stress, anxiety, and depression, can significantly impact erectile function. Counseling or therapy can help address these issues, providing strategies to manage stress and improve mental health. Cognitive behavioral therapy, CBT, and sex therapy are particularly effective in addressing performance anxiety and enhancing communication between partners. 2. Couples therapy. Engaging in couples therapy can help partners navigate the emotional and relational aspects of ED. Open communication and mutual understanding are key to maintaining intimacy and satisfaction in the relationship. Therapy can provide a safe space to discuss concerns, set realistic expectations, and explore new ways to connect emotionally and physically. Conclusion. Erectile dysfunction is a manageable condition with a range of treatment options available. By combining lifestyle changes, medical interventions, and psychological support, men can improve their erectile function and overall quality of life. It is important to approach treatment with an open mind and work closely with healthcare professionals to find the most effective solutions. With the right support and information, men can continue to enjoy a fulfilling and satisfying intimate life. Part 5. The role of communication and support. Effective communication and support are crucial components in managing erectile dysfunction, ED. While medical treatments and lifestyle changes are important, the emotional and relational aspects of ED require attention to ensure a holistic approach to treatment. This section explores the significance of open communication and the various support systems available to individuals and couples dealing with ED. A. Importance of communication. 1. Open dialogue between partners. Open and honest communication between partners is essential in addressing the challenges posed by erectile dysfunction. Discussing ED can be difficult due to feelings of embarrassment or fear of judgment, but avoiding the topic can lead to misunderstandings and emotional distance. By fostering an environment of trust and empathy, partners can share their feelings, concerns, and expectations, which can help alleviate anxiety and strengthen their emotional connection. This dialogue allows both partners to express their needs and work together to find solutions that enhance intimacy and satisfaction. 2. Setting realistic expectations. Managing expectations is a key aspect of dealing with ED. It is important for both partners to understand that intimacy is not solely defined by sexual performance. By focusing on emotional closeness and exploring other forms of intimacy, such as cuddling, kissing, and spending quality time together, couples can maintain a fulfilling relationship. Setting realistic expectations helps reduce pressure and anxiety, allowing both partners to enjoy their time together without the stress of performance. B. Seeking professional support. 1. Therapy and counseling. Professional support through therapy or counseling can be invaluable for individuals and couples dealing with ED. Therapists can provide strategies to manage stress, anxiety, and depression, which are often associated with ED. Cognitive behavioral therapy, CBT, and sex therapy are particularly effective in addressing psychological barriers and improving communication between partners. Therapy offers a safe space to explore feelings and develop coping mechanisms, ultimately enhancing the overall quality of life. 2. Medical guidance. Consulting with healthcare professionals is crucial for understanding the underlying causes of ED and exploring appropriate treatment options. Doctors can provide valuable insights into the medical aspects of ED, recommend suitable treatments, and monitor progress. Regular checkups and open communication with healthcare providers ensure that any changes in symptoms or treatment efficacy are addressed promptly. C. Support networks. 1. Peer support groups. Joining support groups can provide individuals and couples with a sense of community and understanding. Sharing experiences with others who face similar challenges can reduce feelings of isolation and offer new perspectives on managing ED. Support groups, whether in person or online, create a platform for exchanging advice, encouragement, and coping strategies. 2. Educational resources. Accessing educational resources about ED can empower individuals and couples with knowledge and confidence. Books, articles, and reputable websites offer information on the latest research, treatment options, and lifestyle changes that can improve erectile function. Being informed helps individuals make better decisions about their health and fosters a proactive approach to managing ED. Conclusion. Communication and support play a vital role in managing erectile dysfunction. By fostering open dialogue, seeking professional guidance, and utilizing support networks, individuals and couples can navigate the challenges of ED with greater ease and confidence. Emphasizing emotional connection and mutual understanding enhances relationships and contributes to a fulfilling and satisfying intimate life. With the right support and resources, it is possible to overcome the obstacles of ED and maintain a healthy, happy partnership. Part 6. Real-life stories and examples. Understanding erectile dysfunction, ED, through real-life stories and examples can provide valuable insights into the challenges and triumphs experienced by individuals and couples. These narratives highlight the diverse ways people cope with ED, the importance of communication, and the impact of seeking help. By sharing these stories, we can foster empathy, reduce stigma, and inspire others to take proactive steps in managing their condition. A. John's journey to acceptance and treatment. John, a 62-year-old retired engineer, began experiencing erectile dysfunction shortly after his retirement. Initially, he attributed his symptoms to stress and aging, dismissing them as a natural part of getting older. However, as the condition persisted, it began to affect his self-esteem and relationship with his wife, Mary. John felt embarrassed and avoided intimacy, which led to tension and misunderstandings between them. After months of frustration, Mary encouraged John to see a doctor. With her support, John scheduled an appointment with a urologist who conducted a thorough evaluation. The doctor explained that John's ED was likely due to a combination of factors, including high blood pressure and stress. Together, they developed a treatment plan that included lifestyle changes, medication, and counseling. John's story illustrates the importance of seeking medical advice and the positive impact of having a supportive partner. By addressing his health issues and communicating openly with Mary, John was able to regain his confidence and improve their relationship. B. Sarah and Tom navigating ED as a couple. Sarah and Tom, both in their late 60s, had been married for over 30 years when Tom began experiencing erectile dysfunction. Initially, Tom was reluctant to discuss the issue, fearing it would disappoint Sarah. However, Sarah noticed the change and gently encouraged Tom to talk about it. Through open communication, they discovered that Tom's ED was affecting both of them emotionally. Sarah reassured Tom that their relationship was not solely based on sexual performance and emphasized the importance of emotional intimacy. Together, they explored different ways to maintain closeness, such as spending more quality time together and focusing on non-sexual forms of affection. Tom eventually sought medical advice and began treatment with oral medications. The couple also attended couples therapy, which helped them strengthen their emotional connection and improve their communication skills. Sarah and Tom's story highlights the importance of mutual support and understanding in navigating the challenges of ED. C. Michael's experience with lifestyle changes. Michael, a 65-year-old businessman, was diagnosed with erectile dysfunction after experiencing symptoms for several months. His doctor identified several contributing factors, including obesity, a sedentary lifestyle, and high cholesterol levels. Rather than immediately resorting to medication, Michael decided to make significant lifestyle changes to address the root causes of his ED. He began by incorporating regular exercise into his routine, starting with daily walks and gradually progressing to more intense workouts. Michael also overhauled his diet, focusing on whole foods, lean proteins, and plenty of fruits and vegetables. Within a few months, he noticed improvements in his overall health and a significant reduction in his ED symptoms. Michael's story demonstrates the power of lifestyle changes in managing erectile dysfunction. By taking control of his health, he not only improved his erectile function, but also enhanced his overall well-being and energy levels. D. Emily and David overcoming psychological barriers. For Emily and David, both in their early 64s, erectile dysfunction was primarily a psychological issue. David had experienced a few instances of performance anxiety, which led to a cycle of fear and avoidance. The couple realized that the problem was affecting their relationship and decided to seek help from a therapist. Through cognitive behavioral therapy, CBT, David learned techniques to manage his anxiety and build confidence in intimate situations. The therapy sessions also provided a safe space for Emily and David to discuss their feelings and expectations, which helped them rebuild trust and intimacy. Emily and David's experience underscores the importance of addressing psychological factors in the treatment of ED. By seeking professional help and working together, they were able to overcome the barriers that were impacting their relationship. Conclusion. These real-life stories and examples illustrate the diverse experiences of individuals and couples dealing with erectile dysfunction. Whether through medical treatment, lifestyle changes, or psychological support, each story highlights the importance of communication, understanding, and proactive management. By sharing these narratives, we can inspire others to seek help, reduce the stigma associated with ED, and promote a more open and supportive dialogue about sexual health. Part 7. Conclusion. Erectile dysfunction, ED, is a common condition that affects many men as they age, but it is not an insurmountable challenge. Understanding the multifaceted nature of ED, which includes physical, psychological, and emotional components, is crucial for effective management and treatment. This conclusion synthesizes the key points discussed and emphasizes the importance of a comprehensive approach to maintaining sexual health and well-being in older age. A. Understanding and acceptance. The first step in addressing erectile dysfunction is understanding and accepting it as a natural part of aging for many men. It is important to recognize that ED is not a reflection of one's masculinity or self-worth. By acknowledging the condition without shame or stigma, individuals can take proactive steps toward finding solutions that work for them. Acceptance also involves understanding that intimacy and sexual satisfaction can evolve with age, focusing more on emotional connection and shared experiences rather than solely on physical performance. B. The role of lifestyle and medical interventions. Lifestyle changes play a significant role in managing ED. Regular exercise, a balanced diet, quitting smoking, and moderating alcohol consumption can improve overall health and enhance erectile function. These changes not only benefit sexual health but also contribute to better cardiovascular health, energy levels, and mood. Medical interventions, including medications and hormone therapy, offer effective solutions for many men. However, these treatments should be pursued under the guidance of a healthcare professional to ensure safety and efficacy. It is important to have open discussions with doctors about the potential benefits and risks of each treatment option, tailoring the approach to individual needs and health conditions. C. The importance of communication and support. Open communication with partners is essential in managing the emotional and relational aspects of ED. Discussing feelings, concerns, and expectations can alleviate anxiety and strengthen the bond between partners. It is crucial to redefine intimacy beyond physical performance, focusing on emotional closeness and mutual understanding. Support from healthcare professionals, therapists, and peer groups can provide valuable guidance and encouragement. Seeking help is a sign of strength, not weakness, and can lead to more effective management of ED. Professional support can also help address any psychological factors, such as stress or anxiety, that may be contributing to the condition. D. Embracing mature sexuality. Mature sexuality can be as fulfilling and meaningful as it was in youth, albeit in different ways. Embracing this stage of life involves appreciating the depth of emotional connection and the richness of shared experiences. Intimacy in older age can be characterized by tenderness, understanding, and a focus on mutual pleasure and satisfaction. E. Moving forward with confidence. In conclusion, erectile dysfunction is a manageable condition that should not overshadow the potential for a satisfying and fulfilling intimate life. By combining lifestyle changes, medical treatments, and open communication, individuals can overcome the challenges of ED and maintain a high quality of life. It is important to approach this journey with a positive attitude, seeking support and information to make informed decisions about one's health. Remember, Sexual well-being is an integral part of overall well-being. By taking care of both physical and emotional health, individuals can continue to enjoy rich and meaningful intimacy throughout their lives. With the right approach and support, AIDS can be managed effectively, allowing for a rewarding and satisfying sexual life in older age. Thank you for taking the time to watch our video on understanding and managing erectile dysfunction. We hope you found the information valuable and empowering. Remember, addressing this topic openly is a step toward maintaining a healthy and fulfilling life. If you have any questions or thoughts, feel free to leave a comment below. We appreciate your support and encourage you to share this video with others who might benefit from it. Don't forget to subscribe to our channel, Stoic Mind Mastery, for more insightful content. Until next time, take care and stay informed.